You just finished having your anatomic total shoulder replacement. So let's talk about the exercises you need to do right after surgery. The very first day after surgery, after your nerve block wears off, you're going to start moving your hand so that you can make a complete fist. You're going to make your fingers straight, put your thumb up in the air as far as it can go. You're going to rotate your palm all the way up so your palm faces the ceiling, and then all the way down so it faces the floor. This will keep your hand from getting stiff and too swollen. You'll also be bending your elbow. Make sure you use the other hand when you do the bending. Let it come down and then help it as it comes up. Oftentimes we fix your biceps tendon, and if you just do it on your own, that biceps tendon could come loose. So use your other hand to bend it all the way up. The next exercise you're going to do is to start stretching your shoulder, but you're going to be doing it passively because we fixed your rotator cuff tendon in the front of the shoulder. If you bring your arm out to the side like this, it could come loose. Or if you use any weight in your hand, that muscle will pull back away from where we repaired it. So you have to protect it. So how do you safely do that? You use a door handle or a refrigerator door handle that comes up a little higher. And what you do is you grab the handle, your arm is out of the sling and you're up against the handle here, and then you gently walk away from the handle. In the beginning, you'll only be able to come out a little bit. Hold it there for 3 seconds and then walk back. Do this 3 repetitions. And as time goes on, you'll be able to lean further and further and further till it gets down like this. Make sure that you have all your weight on your feet. You shouldn't be using this hand to lean on or hold your weight on. The only thing that you should be doing with your hand is holding the weight of your arm. After you do your stretches, walk back up here. The next stretch you're going to do is a rotation stretch where you rotate your arm out to the side. Now, the first 2 weeks after your surgery, you only rotate your arm from here to here. Don't go out to the side in the first 2 weeks. After 2 weeks, you'll be able to come out to 30 degrees, which is about here. So this is 0, this is 30. And you can do that on your own, just coming to 30 degrees, or if you need a little help, you can hold on to the door handle and then just rotate a little bit. Another way you could do it is to use a cane. So if you hold a cane or a stick and you just push it out to 30 degrees here. Not more than that, because if you go out here, you could pull things loose. So just a gentle stretch like this, and then do your forward stretches like this, holding on to a door handle or a refrigerator door handle. You'll be doing that up to 6 weeks while you're in the sling. After 6 weeks, you'll come out of the sling and we'll give you some freedom and you'll be able to reach with that arm. You'll be able to put a jacket on or a shirt on by reaching into the sleeve. You'll be able to wash your face. You'll be able to wash your hair. You'll be able to turn on the faucet or a light switch. But I don't want you lifting more than a coffee cup because things are still healing in here. So don't lift a heavy bag of groceries or a full basket of laundry. Don't lift a full pot of water from the stove. That's too much weight. Only a coffee cup. And you'll do that after you get out of the sling until it is 10 weeks from your surgery. And during that time, you'll still do your stretches, but you're going to do a little more aggressive stretching to get more motion. So you're going to use a cane to stretch your arm up in the air like this. So you push with your other hand and push that arm up as far as it'll go. You'll find it's easier to do this stretch if you lay on a bed or on the couch. You'll also start stretching the arm all the way out to the side. No more limit at 30 degrees. You're going to go all the way out to the side. You're going to go up and out to the side as well. You're also going to stretch behind your back. So you're going to stretch it behind your back, and you can use the cane to pull your arm behind your back. If you can reach your hand all the way here, you can use your other hand to grab it and pull it up and hold it there for a good 3 seconds before you let it down again. Do each stretch 3 times, so 3 repetitions, and do those stretches 3 times a day. It shouldn't take you long. So dedicate 5 minutes, morning, noon, and night to do those stretches. Now you've done the stretches, you've got good motion in your arm. It's 10 weeks from your surgery. Now you can start lifting 5 pounds with your arm. You can start doing some light weights to get your biceps stronger. You can start lifting heavier things around the house. And you can also start a gentle strengthening program by doing some rowing exercises with some bands and lifting light weight. It will take you a good 3 months of strengthening before you're back to doing most of your normal activities. If you're used to doing things like tennis or fishing or shooting or anything that involves a lot of heavy work on your arm, or like going to the gym or yoga classes, Pilates, that's going to take you a minimum of 3 months to get back to that. And it may take you all the way up to a year to get up to your full capacity. As long as you go slowly and gradually, you'll be able to do it. So if you can do 3 sets of 10 of a weight and it doesn't cause any fatigue or any pain, the next time you do the exercise, increase the weight by a couple pounds. If you keep doing that, you may find you're going to shoot forward. You're going to do really great. And then you might find, I have one day where I went backwards a little bit. What happened? Sometimes there's no good explanation. So sometimes you go 2 steps forward, 1 step back. As long as you keep going forward and keep going steadily, getting more strength, then that's great. And if you follow this protocol, I think you can do a lot of these things on your own. It's okay to use a therapist, and they can help guide you through all these exercises as well. Good luck in your rehab.